correspondent. Thank you. Well, the decision to bring in a second lockdown in England came after concerns about the pressure on the NHS over the winter. Let's speak now to Dame Donna Kinnair, the Chief Executive and General Secretary of the Royal College of Nursing. Firstly, Dame Donna, your reaction to the measures and the timing of them, please.
Well, my reaction is that it's absolutely essential that we go into a second lockdown because we are seeing numbers rising. We are also in the throes of winter when numbers that enter hospital rise anyway. And that in addition to that, we've got pressures from winter, pressures from COVID, and we've got a tired workforce. So we do need people to comply with the latest guidance and adhere to the restrictions that are being put in.
We know that the Nightingale hospitals are being readied. They were set up in that first wave earlier in the year, and we understand that they will be on hand to help relieve some of the pressure on the standard hospitals. But what about the staffing of those? Is there any clarity about where the extra staff and nurses will come from, for example?
Well, we don't have any clarity as yet, and we know that during the first wave we brought over 14,000 people out of retirement and used our student nurses. So when the government says that there are 13,000 more nurses, well, just for the first wave we had 14,000 extra people and we were struggling to cope. So they haven't, and while we've got ventilators and we've got the hospitals and beds, we do not yet have clarity on where the nursing staff to nurse these patients are coming from.
Give us a sense of the mood and the feeling among nurses that you speak to who are dealing with the situation day to day on the front line.
Well, we have particular concerns about specialist nurses because we know that not every nurse is trained to look after patients on ventilation or the patients that are as critically ill as some of them can become. So I think that when I speak to nurses on the front line every day, they are really concerned. Not only are they exhausted, but they're really concerned about some of the things that they're being asked to do that maybe they're not prepared enough to do. And we know that the government already previously cut the education budget for nurses, which meant that we've now got fewer specialist critical care trained nurses. So the morale is tired and anxious. We in the RCN get about 1,000 calls a month with nurses that tell us about the increased anxiety of having worked through this time and looked after patients with COVID, concerned for themselves, but also concerned about their patients.
OK. That said, though, Dame Donna, presumably the government is taking steps to try and relieve that pressure by bringing in this all England lockdown.
Well, that will help, but we know that that doesn't take effect till sometime later. So even if we start the lockdown today, that doesn't stop the cases rises until people really do start complying, and it takes some time, probably 2 weeks or so, to work through the system. So what's happening today will feel the effect still in the future.
OK, Dame Donna Kinnair, Chief Executive and General Secretary of the Royal College of Nursing, many thanks indeed. Well, I'm joined now by